Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor. I've been feeling quite unwell for the past week.
Hello, what seems to be the problem?
I've been having a high fever, coughing a lot, and feeling very fatigued.
I see. Can you tell me more about the cough? Is it dry or are you bringing up any mucus?
It started dry, but lately I've been coughing up greenish mucus.
Oh, I'm sorry to hear that. How about your breathing? Are you experiencing any shortness of breath or chest pain?
Yes, I've noticed that I get out of breath easily, even when just walking a short distance.
That's concerning. Have you noticed any other symptoms like chills, loss of appetite, or sweating at night?
Yes, I've had chills and haven't felt much like eating, and I wake up drenched in sweat during the night.
Have you been in contact with anyone who had similar symptoms or been diagnosed with pneumonia recently?
Not that I know of.
How about recent travel or exposure to any environmental factors that might have affected your respiratory system?
I did visit a friend in the hospital 2 weeks ago, but that's about it.
It's essential to know about that exposure. Hospitals can be a place where infections spread. Have you ever been diagnosed with pneumonia or any other lung diseases in the past?
No, I haven't.
All right. Given your symptoms, I suspect you might have pneumonia. Pneumonia is an infection in one or both lungs. Bacteria, viruses, or fungi may cause it. Given your exposure at the hospital, it's possible you picked up a bacterial strain there.
Oh, that's worrying. What do we do next?
First, I'd like to order a chest X-ray to confirm the presence of pneumonia. We may also need to do a blood test and possibly a sputum test to identify the specific microorganism causing your symptoms.
And how is pneumonia treated?
If it's bacterial, as I suspect in your case, it will be treated with antibiotics. It's essential to complete the full course of antibiotics even if you start to feel better. We may also recommend over-the-counter medications to manage fever and pain. You'll need plenty of rest and fluids as well.
How long before I can expect to feel better?
Recovery time varies. Some people start to feel better within a few days, while others might take a couple of weeks. Given the right treatment, most people recover fully, but it's crucial to catch it early and begin treatment promptly.
I understand. Thank you for explaining everything so clearly.
Of course, it's essential to be well-informed and take this seriously. Let's get those tests ordered for you, and we'll discuss the results as soon as we have them. In the meantime, try to rest and drink lots of fluids.
I will, doctor. Thank you for your help.
You're welcome. Take care, and I'll see you soon for a follow-up.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I see you've come in today with concerns regarding some unusual symptoms you've been experiencing. Can you tell me more about them?
Yes, it started off with severe abdominal pain that came and went, and then I began noticing a change in the color of my urine. It turns a dark purple color after sitting for a bit.
That's quite unusual. How long has this been going on?
The abdominal pain has been off and on for a few weeks, but the urine color change has been more recent, maybe a week or so.
Are there any other symptoms you've noticed? Perhaps any neurological or psychiatric changes? Or perhaps sensitivity to sunlight?
Now that you mention it, I have been experiencing bouts of confusion and anxiety, and my skin does seem to react more intensely to sunlight lately, with itchy rashes appearing on exposure.
I see. Given the symptoms you've described, one possibility that comes to mind is porphyria. It's a group of rare disorders that can affect the nervous system and skin.
Porphyria. I've never heard of it. What causes it?
Porphyria is caused by a buildup of natural chemicals that produce porphyrin in your body. Porphyrins are essential for the function of hemoglobin in your blood. Depending on where the enzyme deficiency or abnormality occurs, different types of porphyrias will result, affecting different parts of the body.
Is it genetic?
Yes, many forms of porphyria are inherited. If someone in your family had it, it could increase your risk. However, environmental factors can also trigger symptoms in some cases.
So what tests do you do to diagnose it?
We'll start with blood, urine, and stool tests to measure the levels of porphyrins. Based on the type and distribution of porphyrins, we can narrow down the type of porphyria and tailor treatment accordingly.
And what does the treatment involve?
Treatment is primarily focused on managing symptoms and preventing complications. This might involve avoiding triggers, medications to reduce the production of porphyrins, and in some severe cases, even hospitalization. For some types, we might use Hemin therapy, which helps reduce the symptoms.
It sounds serious. Is there a chance it could become life-threatening?
Some forms can be serious if not managed properly, especially during acute attacks. It's crucial to get a correct diagnosis and understand how to manage and prevent symptoms. But with the right care, many people with porphyria lead normal lives.
I appreciate your insight. It's a lot to take in, but I'm glad I came in to get checked out.
It's always better to be safe and get a clear understanding of what's happening in your body. We'll work together to get a clear diagnosis and a treatment plan in place.
Thank you, Doctor. I'm grateful for your help.
Of course. That's what I'm here for. We'll get through this together.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Have you had a chance to review the documentation for the new antihypertensive drug that was released last week?
Yes, I have. It's quite promising, especially because it has fewer side effects compared to some of the existing drugs in its class.
I noticed that too. Plus, it can be taken once daily, which might increase patient compliance. But have you looked at the cost?
That's the downside. It's considerably more expensive. It's still under patent, so it might take some time before a generic version becomes available.
That's always the challenge, isn't it? Balancing efficacy with affordability. I guess for now, it will be an option for those who don't tolerate other medications well.
True, and as more studies come out and more patients use it, we'll get a clearer picture of its overall effectiveness and place in therapy.
Now look at question 26.
This new protocol for monitoring premature babies seems more comprehensive.
It does. The focus on early detection of infections and complications can potentially reduce the length of stay for many of these babies.
And the emphasis on parental involvement is a significant shift. I think it's a great step towards holistic care.
I agree. Getting parents involved early on, teaching them about kangaroo care and other techniques, not only helps the baby, but also empowers the parents.
Yes, in the past, there was a more distinct separation between parents and their preemies, mostly because of infection concerns. But with proper hygiene practices, the benefits of early bonding far outweigh the risks.
True. It's all about keeping that delicate balance while ensuring the best outcomes for these little fighters.
Now look at question 27.
Hey, Sarah. I've been trying to get a hold of the regular hypertension medication for Mrs. Thompson in Ward 6, but it seems we're out of stock. Do you know if there was a change in her prescription?
Oh, Brian, yes, there was a notice that came in this morning. There's a manufacturer delay with that specific medication. We're suggesting an alternative for the time being. Did Dr. Grant not discuss it with you?
No, I must have missed it. What's the alternative?
It's called Metapress. The dosage is a bit different, so you might want to double-check with Dr. Grant about adjusting it for Mrs. Thompson. I believe he's made notes in the system.
Got it. I'll look into it and coordinate with Dr. Grant. Thanks for letting me know.
No problem, Brian. Let's make sure Mrs. Thompson gets the best care while she's here.
Now look at question 28.
Hey, Jason. I was looking at Mr. Martinez's meal plan and noticed he's on a high-protein diet. Given his recent kidney issues, shouldn't we be more cautious?
Yes, Emily, you're right. I was about to address that. We're planning to transition him to a moderate protein, low sodium diet starting tomorrow. But I wanted to consult with you first to see if we can incorporate certain foods he likes while maintaining the nutritional requirements.
That sounds good. I've observed that he has a preference for fish and tofu. Maybe we can work those in?
Absolutely. We can opt for tofu dishes and lean fish varieties. I'll adjust the plan accordingly. Thanks for the heads up, Emily.
Always here to help, Jason. Let's ensure Mr. Martinez's meals are both nutritious and enjoyable.
Now look at question 29.
This new monitor uses multi-lead ECGG technology, which provides a more comprehensive view of the heart's electrical activity. It's designed to detect arrhythmias that might go unnoticed with the traditional single-lead monitors. Plus, the data logging feature can record up to 72 hours, and it's synchronized with the patient's symptoms through a dedicated button they can press.
That sounds promising. How does the data transfer process work?
It has wireless capabilities, so once the monitoring is complete, the data is uploaded to our secured cloud. Our analysis software then deciphers the data, and I can review any significant events flagged by the system.
Brilliant. It seems like it'll streamline our current processes and hopefully lead to quicker diagnoses for our patients.
Now look at question 30.
Multiple sclerosis, or MS, is an autoimmune condition where the body mistakenly attacks the protective sheath around nerve fibers, called the myelin. This damage disrupts communication between the brain and the rest of the body.
So it's primarily a central nervous system disorder, right?
Precisely. Symptoms can vary widely depending on the amount of nerve damage and which nerves are affected. Some people might experience fatigue and numbness, while others may have more severe symptoms like paralysis or loss of vision. The disease can be challenging to diagnose because its symptoms are similar to other conditions.
And how do we typically treat MS?
Currently, there's no cure, but treatments can help manage symptoms and reduce the progression of the disease. This might include drugs to reduce relapses and manage symptoms, physical therapy, and other supportive treatments. Regular monitoring and adjustments in treatment are essential to manage this lifelong condition.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, listeners. Today we are joined by Dr. Stephanie Carter, a leading expert on parasitic infections. We'll be discussing a rather underestimated infection known as amoebiasis. Dr. Carter, thank you for being with us today. Can you enlighten us about amoebiasis?
Certainly. Amoebiasis is an infection caused by the parasite Entamoeba histolytica. It primarily affects the intestines and is more common in tropical regions with poor sanitation. Many people who get infected may not show any symptoms, but those who do can experience diarrhea, stomach pain, and even bloody stools. In severe cases, the parasite can spread to other parts of the body, like the liver, forming abscesses.
That sounds quite unpleasant. What factors contribute to someone contracting this infection?
While the parasite is primarily transmitted via contaminated food or water, it's common in areas with poor sanitation and hygiene practices. Consuming water or food that has been in contact with the feces of an infected person is the primary mode of transmission. This also implies that person-to-person transmission is possible, especially in places where hand washing might be less frequent or effective.
Now, can you share with us any memorable patient story dealing with amoebiasis?
Absolutely. I treated a 32-year-old woman who had recently returned from a trip to a tropical country. She came to the clinic with severe diarrhea and abdominal pain. At first, she thought it might be a common traveler's diarrhea, but when her symptoms persisted and became more severe, she sought medical attention. We ran some tests and the stool sample revealed cysts of Entamoeba histolytica. We initiated treatment and she began to improve within a few days.
That must have been a relief for her. Now, if someone is diagnosed with amoebiasis, what is the typical treatment approach?
The primary treatment for amoebiasis is specific anti-amoebic drugs. Metronidazole is the most commonly used one. It helps in reducing the symptoms and kills the parasite. After the primary course of treatment, we often prescribe another medication, like paromomycin or diloxanide, to eliminate any remaining cysts in the intestine, ensuring that the infection is completely cleared.
And how about prevention? Any advice for our audience, especially those planning to travel to tropical regions?
Great question. Prevention is always better than cure. When traveling, always ensure you're drinking bottled or boiled water. Avoid ice cubes unless you're sure of their source. Practice good hand hygiene by washing your hands thoroughly with soap, especially before eating. It's also a good idea to avoid raw vegetables and fruits unless you can peel them yourself. And if you're staying in a tropical region for an extended period, consider regular checkups to catch any potential infections early on.
That's really insightful. Dr. Carter, thank you for sharing your expertise on amoebiasis with us today.
My pleasure. Always remember, being informed and cautious can save you from a lot of health troubles. Safe travels to all.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Septicemia, commonly referred to as sepsis, is a grave medical emergency that results from the body's severe response to an infection. Dr. Rohan Patel, an expert in infectious diseases, joins us today to share insights about this condition. Dr. Patel, can you give us a clearer understanding of septicemia?
Certainly. Septicemia or sepsis is when the body essentially overreacts to an infection, which can cause inflammation throughout the entire system. This reaction can lead to a cascade of changes that can damage various organs and tissues. If left untreated, it can lead to organ failure or even death. Key indicators often include fever, high heart rate, and rapid breathing. And because it can originate from various kinds of infections, be it from the lungs, abdomen, or even a simple wound, it's essential to identify and treat the root cause promptly.
What are the common challenges in treating patients who suffer from septicemia?
The initial challenge is timely diagnosis. Sepsis can sometimes be mistaken for other conditions, especially in its early stages. Once diagnosed, it's a race against time. Immediate treatment often involves broad-spectrum antibiotics, but the key is to quickly identify the specific pathogen causing the infection and adjust treatment accordingly. Another challenge is supporting the patient's organs, which may be compromised due to the body's reaction. This might require ICU care, including oxygen and intravenous fluids, or even machines to support organs like the kidneys or lungs.
It must be a race against time. How are patients and their families usually counseled through this?
It is indeed intense. We emphasize to the families the critical nature of sepsis and ensure they understand the treatment plan. It's essential to keep open communication lines, updating them on the patient's progress and addressing their concerns. Emotional and psychological support plays a crucial role, as the sudden and severe nature of sepsis can be overwhelming.
In terms of technology and treatment advancements, what's on the horizon for managing and treating sepsis?
There's ongoing research into biomarker identification, which could help in the faster diagnosis of sepsis. This would enable clinicians to start treatments even before conventional test results are available. Additionally, machine learning and AI are being explored to predict which patients are at the highest risk of developing sepsis from an initial infection. On the treatment front, we're also looking into novel antimicrobial agents and therapies to combat resistant pathogens, as antibiotic resistance is a growing concern.
And how are hospitals preparing for such advancements?
Hospitals are investing in rapid diagnostic tools and fostering collaborative research. Interdisciplinary teams, comprising microbiologists, pharmacists, and infectious disease specialists, work together to ensure that patients receive the best care. There's also an emphasis on sepsis education and training for healthcare professionals to recognize the early signs and symptoms.
It's clear that septicemia remains a significant challenge, but with dedicated professionals like you and the advancements on the horizon, there's hope for better outcomes. Thanks for shedding light on this crucial topic, Dr. Patel.
Thank you. The key remains awareness, prompt action, and continuous research to better understand and combat sepsis. We must all remain vigilant.